Hello, everyone, and welcome to the July edition of the NACCHO Model Aquatic Health Code Network webinar. This month's theme is Drowning is Preventable, with our featured speaker, Sarah Chairs. Before we begin, there are just a few logistics to go over. You can listen to the audio for this webinar through your computer speakers or by dialing in using the phone line prompt when you open Zoom. Due to the number of attendees on the webinar, you will all be muted automatically. So please submit any questions and comments via the chat box. The Q&A portion of today's webinar will take place after the presentation, but please feel free to submit any questions or comments at any time. Finally, this webinar is being recorded, and the slides and the webinar itself will be available to all participants. And so with that, I would like to go ahead and pass it on to Doug Sackett, who is the Executive Director of the Council for the Model Aquatic Health Code, with a few updates.
Thanks, Grace, and welcome everybody. Next slide. We do have a few updates that we want to brief everybody about. We've got some staff changes and some committee work and some membership. So next slide. We're excited to announce that we've hired a new executive director for CMAC, Christy Reister, and her email address is christyreister@cmac.org. You can view Christy's bio on the cmac.org website under administration. And I now am the technical director of CMAC. Still, everything, the contact information is still the same. We're also very pleased to announce a new Director of Administrative Services, Susan Whitman. A lot of you may know Susan from her years with the National Swimming Pool Foundation, NSPF, but we're pleased to have her join our team. So again, welcome to Susan and Christy as new members of the team at CMAC. Next slide. We also, an update, we're going to be soliciting applications for the two committees, Technical Review Committee and the 7 technical support committees as we start the next round of MAC updates. The change request period formally opens in September, and we want to start getting our team together as far as the technical review committee and TSCs as soon as possible. They're going to hit the ground running in January to start to review and work on the change requests. So you'll be seeing some announcements come out in the next few weeks probably with the revised application form. If you're interested in participating as one of the technical review committees or the technical support committees. Again, the TSCs are subject matter experts in those particular subject areas. Next slide. We also have a couple new ad hoc committees that are busy at work. The Spray Ground, Spray Park, which Interactive Water Venue Design Committee has been formed, and they've actually began their work in early June, and they're evaluating and looking at the spray ground requirements and updating proposals to update the MAC as appropriate as they continue to work. We're also in the process of starting a surf pool ad hoc committee. These large surf pools becoming more popular. We've got a couple placeholders in the MAC that we identify them, we define them, but we don't have detailed requirements. So this committee will start working on some detailed requirements for surf pools to consider inclusion in the MAC. Next slide. And finally, we encourage you to renew your membership for those that have been members. Everybody's expired at the end of the last code update cycle, November 2017, and you need to be a member to be participate in the committee work and to vote on the code changes. So again, we encourage you to go online and renew your memberships. And for those that have yet to become members, please sign up and be part of the team to keep the MAC updated. Next slide. And there's some contact information both on the MAC and for the CMAC. And finally, my contact information, which will be on the slide. And Sarah, I'll turn it back over to you to get to, Grace, I'll turn it back over to you so we can introduce Sarah. Thank you.
Awesome. Thanks so much, Doug. That's exciting to hear all your updates from CMAC. So without further ado, we'll move on to our featured presenter. Sarah Chairs is a family nurse practitioner and a medical provider at UNC Hospitals Level 1 Trauma Center. Mrs. Chair's idea for the nonprofit Carolina Swims Foundation developed when she saw the joy on her own children's faces when they learned how to swim and wanting to give that joy to all other children. Her experience as an emergency department provider demonstrated the palpable and tremendous costs that submersion, non-fatal drowning, and drowning put on families and the community. And Mrs. Chairs hopes to give the gift of swim to all children, and by doing so, combat the high rates of childhood death from drowning. So thanks for joining us today, Sarah, and take it away.
Thank you so much for joining. So how can health officials protect the public from drowning? So how big is the drowning problem? Well, it's the #1 cause of death for children 0 to 4 years. It's the #2 cause of death for children up to 14 years behind car accidents. Just shy of 4,000 fatal drownings a year in the US. And in North Carolina, where I live, about 102 people drown every year in North Carolina. About 7,000 non-fatal drownings present to emergency departments, primary care providers every year, and at least 60,000 documented lifeguard saves per year. I'm sure there's many more that are not documented. So my take-home message today is that drowning is preventable. So the background on drowning. Drowning is the process of experiencing respiratory impairment during submersion in liquid. So the potential for brain injury due to the lack of oxygen. So fatal is what most people think of, and then non-fatal are those people that survive initially, may go on to die later, or do survive. So the possibility and the prognosis for long-term care and brain damage is great. So drowning by the numbers, it's the #5 cause of unintentional deaths from injury for all ages. It disproportionately impacts children. It also disproportionately impacts males. They tend to be higher risk takers, and African Americans, 5.5 times higher. But drowning can happen to anybody. This is a video that I won't show, but you can find on YouTube. It's a boy in Finland who's 5 years old, who's at a public pool that has water features and currents, and there's no lifeguard on deck, and there's no rope to identify the depth of the water becoming deeper. And the boy, who is unsupervised, loses his footing, and because of the current, continues to be tousled. And so for 5 minutes on surveillance, he is in the process of drowning, and the pool has a lot of adults and people around, and no one recognizes that he is drowning. There's no lifeguard on deck who recognizes and is ready to save the child. So how are we doing in the US on drowning prevention? So areas in the US that are warmer, have a warmer climate, areas in the US that have larger bodies of water tend to have higher rates of drowning. It's hotter, people are going in the water to cool off. Drowning by numbers. So the cost of drowning in the US, and this is data from the CDC, in 2010, there were 3,500 lives lost from drowning and 7,100 non-fatal drownings. It was a total cost of $6.1 billion. So the cost of the medical resources, the cost of the investment in those individuals' lives, the cost of the productivity of what that individual would have been is $6.1 billion to the US. So we as healthcare providers, we as city health county officials need to think about how we can prevent drowning so that we can save lives and help reduce these tremendous costs. So trends in fatal drowning. So if you look at this graph, really since 1999, 2000, 2001, we've been quite stagnant at combating the rates of drowning. It has stayed the same. And even with all this technology, it still has stayed the same. This is looking specifically at 2000 to 2016 and the rates of drowning in the US. And as you can see, it pretty much is the same. And even though one life, the number 1.3 may not be significant, it's someone's child. It's someone's neighbor. It's someone's classmate, cousin. It impacts our community so tremendously. This is North Carolina, again, where I live. You can see since 2000, we have made very little improvement at combating the rates of drowning in our own communities. So how can we prevent drowning? How can you, as county and city health department officials, prevent drowning? Where do we start? So drowning prevention, it's eerie, right? Ghostly eerie. So we need to educate. We need to become educated on fatal and non-fatal drowning prevention practices and trends. Then we need to educate others on the need to become educated on drowning prevention and education. Then once we become educated, we can evaluate. So we can evaluate what the current trends are and what the local practices are of our open bodies of water or our private or public pools, understanding what they're actually doing, not what they're telling us they're doing, but what they're actually doing to help prevent injury, illness, and drowning. Then we need to regulate. So creating opportunities for regulation that is designed to prevent injury, illness, and drowning. So regulation that will prevent drowning. Then we need to implement and enact that regulation to prevent the injury, illness, and drowning. And the most important is we need to enforce it. We need to make sure that there is 100% compliance with the regulation that keeps the consumer safe when they go to private and public pools and open bodies of water to prevent drowning. This is from the American Red Cross. So the idea of the circle of drowning prevention, it is layers of protection that are essential to help prevent drowning. So those layers of protection, barriers. You need actual physical barriers around water to keep people out and protected from drowning. Fences, four-sided fences, enclosures, tops on top of pools. Then we need life jackets, USA certified Coast Guard life jackets. If you're not a strong swimmer, there needs to be life jackets available. Boating, you need to use life jackets. Then we need to educate the public on the importance of learning how to swim and making sure swim lessons are available to all. And Carolina Swims Foundation, the nonprofit that I started, we provide free swim lessons to children in foster care to give the gift of swim to those children. So those 11,000 children will know how to swim. You need to provide close and constant attention to children when you're supervising them near the water. Not playing on the phone, but in hand's reach. And then lifeguards, swimming at pools where there are certified lifeguards, or other pools where there's lifeguards and open bodies of water. Lifeguards are trained. They know how to recognize and reduce dangerous activities. Lifeguards are trained to recognize the signs of drowning. Drowning can take 18 seconds in 2 inches of water. It can take no time at all, and it is silent. It is not like the Jaws movie. It is silent. Then we need to be able to respond with life-saving equipment. We need to make sure that those public pools have life-saving equipment that works, that's readily available. A 2011 study said that if swimmers swam in front of a lifeguarded area, the risk of drowning would be much lower if they were in that lifeguarding setting. So this is again from the Red Cross, so the circle of drowning prevention. So layers of protection are essential to help prevent drowning. Plan ahead. So provide close and constant contact to the ones that you are watching in the water. Fence pools and spas, backyard pools, public pools, hotels, motels. Learn how to swim. Provide water safety instruction. Put children in life jackets or adults in life jackets if they're not swimmers, or if they're boating. Have life jackets available. And then always swim in a lifeguarded area. The chain of drowning survival. A person who is drowning has the greatest chance of survival if these steps are followed. So 1, recognize the signs that someone's drowning and shout for help. Help. Rescue and remove the person from the water. Find safety devices that are reachable that you can help save their life. Make sure that that aquatic venue or where you're swimming, that there is a way to call EMS, a landline, cell phone tower. Know CPR. Make sure everyone that you work with and you have in your family knows CPR. Begin CPR. And then have AEDs that are charged and not expired, ready to use. This will help the outcome of drowning. The picture on the left had a link to, this happened a week ago, a 1- and 3-year-old boys, they were brothers, and they somehow got into the backyard pool and drowned. And the picture on the right is how beautiful the fence looks around the pool, keeping everybody safe. These are fabulous resources, obviously the model for the Aquatic Health Code, and then the Council, and then the American Red Cross has a link for their science and their current water safety recommendations. And then the National Drowning Prevention Alliance and National Swim Pool Foundation. So this is from the Council for Model Aquatic Health Code. This is a quick summary of how consumers, communities, patrons, the public want to use clean waters. They want to have recreational time in the water. They expect it to be safe. They expect not to get injured or to become ill or to drown. So it's our duty to make sure that those waters provide a fun, safe environment for them. So the Model Aquatic Health Code and the Annex, I'm focusing on lifeguard and how we can help prevent injury, illness, and drowning with the use of lifeguards with the Model Aquatic Health Code. So it's a voluntary, you can adopt it. There's different ways you can adopt it, both short and long forms. The adoption of the code regulates water venues to make swimming and other water activities healthier and safer for the public. It reduces the risk for outbreaks, drowning, and pool chemical injuries. And it saves resources because you don't have to reinvent the codes in each jurisdiction. It is all inclusive. It addresses every aspect of that water, from design, construction, operation, maintenance, policy, management of the public facilities, and the personnel. I'll skip these. These are just examples of all the things that it covers. This I put together. This is the specific ordinances that pertain to certified lifeguards. So this is a quick reference so you know the page number and the ordinance so that you can find that information on what the Model Aquatic Health Code recommends concerning lifeguards. So the references are at the top in the orange. So the Model Aquatic Health Code, the rationale for when lifeguards are needed. So lifeguards are needed if the depth of the water of the aquatic facility is greater than 5 feet. And the rationale is that most adults are able to have their head above the water, but if it was deeper than 5 feet, then they themselves could get into trouble and not able to then go rescue somebody. So the depth of the water needs to be greater than 5 feet to have a certified lifeguard. Children under 14, if there's going to be unsupervised children under 14, even though they're almost adults, there needs to be a certified lifeguards on deck to help make sure that they are safe. And they looked at the height of females that were 14 and they're 63.4 inches. So the idea that then as well, they would need to have lifeguards with the depth of the water. Dedicated surveillance is a responsibility of the qualified lifeguard to make sure that everyone there that is using the aquatic facilities is safe and protected. Oftentimes, if they're chaperones or camp counselors, they aren't CPR or AED certified. And their ratios may be 1 to 6. And they're managing the activities that are going on. So you need people that are dedicated, that are certified, that are trained at that aquatic facility to manage the safety and supervise everyone at that facility. This link is a live link to a 7-year-old boy that drowned in North Carolina, who was at a very nice country club day camp that had a portion of the day swimming, and the parents who were visiting from the area made sure that the GM and everyone knew that this boy was not a strong swimmer, and they were reassured that he would be safe. And they had a chaperone and a lifeguard. There were about 60 patrons in the water for one lifeguard, and the camp counselor had her back to the pool just 8 feet away from this little boy. And for 2.5 minutes, caught on surveillance, he struggled and eventually drowned. And 2 little girls found his body on the bottom of the pool and pulled him up. They then got the lifeguard's attention, who then started CPR, but left the 59 other people in the pool unsupervised. The camp counselor wasn't CPR trained, and the AED that they had there, another personnel at this club advised them not to use it because you can't use it when someone's wet. So all of these things could have been done better to prevent the drowning of this little boy. So protecting consumers from drowning, again, the rationale for why we need lifeguards. So if there's groups of people coming into that water venue, that aquatic venue, youth swim teams, adult swim teams, exercise groups, swim lessons, you need to have a dedicated person watching the safety of all the patrons. I will read out this quote from the Model Aquatic Health Code. Group swim lessons are an obvious reason to have a qualified lifeguard, as participants are not proficient at swimming, thus at higher risk for drowning. Lifeguard training, sports, exercise programs, and competitive swimming involve bathers physically exerting themselves and could result in bather distress. If the instructor is focused on an individual, the risk of a different person drowning unnoticed is higher than if a qualified lifeguard was assigned just to patron surveillance. Last year, 2018, in Montreal, Canada, there was school-wide swim lessons that were going on, and the 14-year-olds had their designated swim lesson, and that particular day, the normal swim instructor wasn't there and replaced by someone who was not qualified as a swim instructor. And the lifeguard, the one lifeguard, noticed that the swim instructor was having difficulty teaching the lesson. So the lifeguard got down off the stands and went down into the pool and started working with the 14-year-olds in the water, helping them teach them how to swim. 45 minutes passed, and when they were making sure all the swimmers were out of the water for the next class that was coming in, they realized a 14-year-old boy was missing. Well, he had been on the bottom of the pool for the past 40 minutes because the lifeguard was busy helping with the swim lesson and not in the dedicated role of patron surveillance. So again, the take-home message, drowning is preventable. Large aquatic venues. So based on the idea that an untrained person could throw a rescue device 30 feet, if the pool is bigger than that, then you need lifeguards to make sure that they can then rescue the person. Moving water. If there's moving water, there's a greater chance that someone in distress could get moved away from an area of safety. So making sure that if there's large aquatic venues and moving water, then you have lifeguards on deck. Water slides, landing pools, platforms, diving boards, anything that could cause someone to enter the water above the water and potentially injure their spinal cord or a head injury, have an accident, and therefore be submerged in water could lead to drowning. So any opportunity for that needs to have certified lifeguards. Alcohol use. Whenever alcohol is served at a pool or aquatic venue, the chance of drowning goes up. So you need to have certified lifeguards to make sure that if a parent or a caregiver has lost some of their attention on the people they're supervising, that there are lifeguards to cover. As well, alcohol use increases one's risk-taking behavior. And so suddenly their simple dive off the side now may be a back flip going off the diving board and they hit their head. Protecting consumers from drowning. How does the MAHC help? The MAHC sets up lifeguards for success. It talks about adequate training. It talks about victim recognition. It talks about rescue skills and how often they have to be practiced. It talks about preventative lifeguarding. It talks about pre-service and in-service training and the need for the continued education. It talks about the number of guards needed for the zone of patron surveillance, the size of the pool, the shape, the blind spots, the response times. It covers all of it so that the lifeguards can be successful in preventing drowning. Again, this is a live link to obviously a very wonderful looking outdoor aquatic venue. The video is a lifeguard who recognizes that a child who has just flipped off the inner tube is now in distress, and the lifeguard is sitting at an elevated position and is able to jump into the water with a safety device and reaches the child within seconds and prevents a potential for drowning. So zone of patron surveillance. So growing up, it was the idea of lifeguard and swimmer bathing ratio. No longer the case. So the MAHC really talks about having a safety plan and having all the stakeholders be a part of the safety plan before the building or the aquatic venue opens up. So understanding what the facility looks like and then determining the number of lifeguards that are needed to properly zone the patron area. So the goal, the idea is that wherever the lifeguard is, they need to be able to get to a victim within 20 seconds after identifying that they need help at the furthest point of that area. So looking at the entire facility and determining where those positions need to be before the doors open. So again, depending on the water venue, does the lifeguard need to be roaming? Does the lifeguard need to be elevated? Does the lifeguard need to be positioned a certain way to be able to see beyond that water feature? It must stipulate how to see that entire area. And then the safety plan needs to talk about how they overlap to make sure that no area on deck and in the water is not supervised. So this again is a live link to a beautiful spa where a gentleman drowned. There was no lifeguard on duty, no one to make sure that he was okay. And you know, anyone that's being active in physical activity is at risk for going into distress. And so it may be in this particular case, he went into some sort of cardiac distress and there was no lifeguard available to rescue him and he drowned alone. These images just help to identify the idea, the importance of water features and making sure that those patron zones of surveillance are clear. So on the left, we've got moving current, we've got water slides. On the right, we've got obstacles, barriers of sight, so someone could be hurt and in behind one of those. Again, on the left, we've got moving water and different things and noisemakers. So drowning is silent. You're not going to hear somebody necessarily calling for help. And then on the bottom right, this is a great illustration of glare. So if you're one lifeguard on duty, you're not going to see the swimmer over by the ladder that has gone under because the glare is so strong. So vigilance. There was a lot of research that was done to look at attention span and the ability for a lifeguard to stay vigilant in the surveillance of the pool. And what they determined was it's really just 20 minutes if hand signals are being used, if there's time for rotation and there's times for breaks. So it's important that this be adopted in terms of appropriate amount of vigilance and not one lifeguard for 8 hours expecting to have the same outcome at the end of those 8 hours. So off-duty lifeguards need to be able to take a break, to reset, to get ready again, to be vigilant to save lives. All zones of patron surveillance must be staffed unless the aquatic facility can effectively limit access to that restricted area. So this goes back to the Red Cross slide of barriers, right? Barriers of protection, layers of protection. So you can't have a back door open to the pool and a sign outside saying it's closed and no lifeguard on deck. You have to be able to secure the access. I'll read this quote. The factors of recognition, intrusion, and distraction have been identified as major contributor to drowning in guarded venues. Nothing should be allowed to interfere with a lifeguard's duty to perform patron surveillance. The MAHC agreed that qualified lifeguards performing patron surveillance should not be doing other tasks that could distract them. When on duty, a qualified lifeguard should scan and supervise the aquatic venue with no other distracting activities, including cleaning, water testing, talking with patrons, etc. So the drowning in Montreal, clear example, lifeguard left his active duty to go help teach a lesson. This is another example. This was a 4-year-old boy that drowned at a swim camp. The camp counselor had this boy and some other boys in the water and aggressively dunked him 12 times in the water, and the little boy was already fatigued. And then other children came along and were playing, chasing the camp counselor, and the camp counselor was running and swimming through the water. And this little boy couldn't touch the bottom, and now he was in the middle of the pool, no longer being held by the camp counselor, and was struggling to try to get to safety and struggling trying to get to somebody. And there was a lifeguard on deck, but that lifeguard was distracted with talking and fixing the umbrella and doing that sort of thing. And it went on for 8 minutes, this video, where this little boy, not many feet away, struggled. So again, lifeguards cannot be distracted with other tasks. This talks about the proficiency of the lifeguarding skill. So we mentioned earlier, the MAHC sets up lifeguards for success. So it talks about what needs to be done to make sure that that safety plan is successful, to make sure that that supervising lifeguard is successful, to make sure that those employed lifeguards are successful. So the pre-service, the in-service, the practicing the rotations to make sure that every part of it is successful to prevent drowning. And then keeping documentation, making sure that all those documents are there. So you as city and county health department officials can adopt the MAHC and know what to expect and what appropriate documentation is. So why would you not use lifeguards? I find this baffling personally as an ER provider who has cared at the bedside for drowning victims as they've come in, and parents screaming at the bedside, hoping that little Johnny survives and knowing that little Johnny probably isn't going to survive. So why would you not use them? And what I understand is that they think, these aquatic venues or people that run them think that, oh, I'm going to minimize my litigation risk. If I put a sign up that says no lifeguard on duty, then I've washed my hands of the potential that I'll get sued. And I don't want to have to deal with the time it takes to recruit lifeguards and to train them. I don't want to pay for them because my budget might have greater profit margins if I don't. So when Carolina Swims Foundation does these free swim lessons for children in foster care, I've noticed at local pools, public pools in North Carolina, more and more I'm seeing the sign that says no lifeguard on duty. And even if there is a lifeguard on duty, they may be sitting in the stand with their phone, or I've seen them with their eyes closed, or they just get up and they walk away. So even if they're there, the dedication to the vigilance of saving lives isn't there. So we need to make sure that we come up with regulation and we enforce it to make sure that the consumers of these wonderful water venues are safe, that we're preventing drowning. This is from the CDC. These were 3 case studies that were done. So Florida County, and they eliminated lifeguards in 1989. And within 1 year, 5 people drowned and 20 others nearly drowned. The county reestablished the need for lifeguards, and for the next 8 years, there were no more drownings. So lifeguards were able to recognize victims in distress and prevent non-fatal and fatal drownings. Hawaii County, from 1985 to 1991, 2 drowning deaths, 40 near drownings. They put lifeguards in place, and for the next 10 years, there were no drownings. Third case study, California Beach, 7 drownings in 1998 after lifeguards were moved, which exceeded the previous 6-year total. They reinstituted lifeguards, and there were no more drownings for the next decade. Protecting children, protecting our communities, and protecting lives is good for the nation. It's cost effective. If we can put in those layers of protection to prevent drowning, then we're going to reduce the $6.1 billion cost that it is for the drowning that is happening in our nation currently. We're going to bring down those acute, subacute, and chronic medical care costs. We're not going to have those caregivers that are burdened with the cost of their loved one that survived but now needs chronic care the rest of their life. The investment in those children, all the wellness visits and vaccinations and school and everything else that we've put into creating this wonderful new adult, we're not gonna lose that. The emotional burden, again, I've been at the bedside. It is awful. The emotional burden that that family has to endure the rest of their life. For those caregivers that fight against the race of time to save that individual. For those neighbors, aunts, uncles, grandparents, communities, schools, that then know that that loss of life, that child, that friend, it just makes sense. It makes sense for us to regulate and enforce best safety practices at our aquatic venues and open bodies of water to prevent injury, illness, and death. It just makes sense. So the take-home message, again, is that drowning is preventable, and I've included those CDC MAC resources as well. Thank you very much for your time.
Awesome. Thank you so much, Sarah, for that really interesting and heartfelt presentation. We do have one question in the Q&A box. So everyone, please feel free to use either the Q&A or the chat box when submitting your questions. But first of all, I just had kind of one of my own, and I was wondering if you could speak maybe a little bit more about the safety plans and some things that kind of go into those, if that's okay. And then I know we also have Doug on the line as well to answer questions, and Joe of CDC.
Okay, so I'm on the slide about the safety plan.
Sorry, please go ahead.
Okay, so the safety plan helps to scientifically look at that facility and to understand what needs to be done based on the water features and everything that's going to be there to make sure that people are safe. So all the stakeholders are aware, it's predetermined, and it's specifically outlined in the safety plan. And then they understand what those zones of patron surveillance are and the number of qualified lifeguards it would take to make sure that anyone that would be above the ground or in the water, you know, is going to be safe. To be able to see all that area.
Very cool.
Sorry.
That's great. No, thank you. I was just wondering if there's some kind of process or if you know of any examples of jurisdictions that have implemented a safety plan at this point.
Doug?
Yes, it's actually, hopefully you can hear me. I understand I was a little bit not loud enough when I did my part of the presentation, but there's a number of, depends on jurisdictions and actually lifeguard organizations. I see that Joe Stefaniak from Ellison Associates is part of the webinar. And I know as an example that Ellison Associates, they do risk management, and they set up, you know, when they're out guarding a facility, they look at the zones of patron surveillance, and it's all determined. They go through the process to make sure they can adequately cover and respond in the time frames appropriate based on what's at a facility. I know in New York State, for example, they've required safety plans at other public pools and beaches and children's camps. And so the many thousands of facilities in New York State are all required to have a safety plan and implement that. And the health department staff, when they go out and inspect, they're part of it is checking for what's in the safety plan and is it being implemented? Because like anything, the best plan in the world doesn't do any good if it's on a shelf somewhere and staff that are part of it aren't even aware of it, yet alone implementing and follow the procedures. So I do know the concept is out there and being implemented around the country.
That's great, Doug. Thank you. And I hope that in some of our future work with NACCHO, we'll be able to get some more of those case studies and share them with you all. We have a question from someone in the audience who's asking, will the MAHC be expanded to include safety regulations in natural waters, or will CDC develop other standard guidelines to address natural water drowning?
Yeah, this is Joe from CDC. Currently, right now, the MAHC is for man-made venues where the water has been treated and manipulated to ensure the safety for the bathers. Currently, CDC does not have a similar set of documents for natural bodies of water. A lot of that has to do with water quality issues that are highly variable under natural settings, and the EPA does offer some water quality guidelines in that regard. Having said that, CDC does want to make sure that all recreational waters are safe and can be insured for the sake of public health. So that very well may be an avenue we look down, either in conjunction or independent of the MAHC. Doug, did you want to add anything?
Joe, that was good as far as, you know, the MAHC attention. I do know that there are other lifeguard organizations and training organizations that do deal in the open water environment, the natural water. And as folks like June, I assume you know too, a lot of states have jurisdiction over natural bodies of water, public beaches, and requirements for proper supervision. So it's not as focused as the MAHC for treated bodies of water, swimming pools, but there are organizations out there and departments and that do have requirements and oversee natural bodies of water and proper supervision.
Awesome, thank you both. So maybe we can get some of those resources out to you all when we share the slides. We did have another question about if the slides will be available. So yes, they definitely will be. So you'll be able to get access to some of the videos if you didn't have a chance to look at them today. And the recording of this webinar will also be available. We did have a question from someone about the case studies, and they're asking how many near drownings still occurred, even though you had some really amazing results with eliminating drownings for 8 to 10 years at a time. They're asking if there were still any near drownings following that.
Yeah, so great question. So unfortunately, that data is really hard to obtain because not every rescue is recorded. And so you're counting on individuals to have the same set of standards in what is considered a rescue in a near drowning or non-fatal drowning situation. So it's really tough to get that data. So that's at the beginning when I estimated about the 60,000, that's data that came from the CDC on what they suspect is sort of the estimated rates of drowning. But myself, I know I've seen so many times where, some random person jumps in the water and saves somebody, or a lifeguard jumps in and saves somebody, and it's not always being recorded. To add to that, I think that there's an opportunity for scientific study and development in, are we really capturing the number of drowning deaths that are occurring? So they may be non-fatal in the ER because we've stabilized them and they get admitted to hospital. And then if they don't drown that next day or 2 days and convert to a death, is the medical community really able to track that data and understand that data? So if they go on to live in a rehab facility for 3 years and end up dying because of a complication, on the death certificate, is it really secondary to a non-fatal drowning, or is it listed as, an MI or whatever it was in that last moment? So I really think the rates of drowning are much higher than what we understand, and working collaboratively to come up with better tracking systems to know that these are the actual number of non-fatal drownings, and we're collecting it from urgent cares, from pediatricians, from primary care, internal medicine, and then these are the visits that are coming into the ER, and they're surviving outside of the ER, and then they're surviving 10, 15, 20 years and not then passing because of the complications.
That's a really nice lead into our next question, which is from a member of the audience asking, I've heard that where a child can die hours later from drowning due to water in the lungs, is there a way to recognize this on the part of the lifeguard or the parents early on, perhaps after the near drowning? And how would you recommend that we educate people about this risk?
Yeah, great question. Thank you. So myself, ER provider, mother of 3, I've actually taken my own child to the emergency department in the middle of the night to be evaluated for secondary drowning. So it's where they're in the water and they inadvertently aspirate on water, and then sometime later in that night or evening, whenever they're lying down and they're in bed, the water then pools in the bottom of their lungs as they're horizontal. So then it limits their ability to have that gas exchange for the inhalation of the air. So what happens is the body then, and because they're young and healthy typically, their body then reacts. And so you get mucus and swelling, and of course they get anxious and they get more short of breath. And so often what happens is at nighttime when the child's sleeping, they'll suddenly sit up and they'll be short of breath. And so they'll be in acute respiratory distress and they'll have projectile vomiting. And that projectile vomiting is one of the sort of signs and symptoms. And it really is good history taking of what those events were earlier in the day. And then that presentation at night to bring them in. And you take them to the ER and they do a chest x-ray. And if the lungs look clear and the child now is calm, then you may send them home and have them sit upright, but you're out of that danger. So it's really difficult to catch, but it's really important to be mindful and to educate. And so whenever I'm talking to parents about swimming and water safety, I always talk about that. And that particular day in my family, it was a babysitter that took my kids to the pool, and my then 5-year-old still was not a strong swimmer, and there were lots of kids and they were just all roughhousing. So throughout the course of an 8-hour day, he had inhaled a lot of water and then woke up gasping, choking, in respiratory distress, and had projectile vomiting. So we went to the ER.
This dog, I'd like to...
Oh, that's so scary. How was that resolved?
Oh, fine. He's fine.
So what is I'm curious what the treatment is then. Is it, hang them upside down?
No, I mean, your body needs to reabsorb it. Now there's lots of talk on whether or not this really happens or doesn't happen, but it in my medical profession and in my practice, I believe it does. And so it's making sure that they're not in acute respiratory distress. It's doing that chest x-ray to make sure that their lungs are clear and that they have adequate ability for gas exchange, and their O2 fat, is high enough. And so, understanding that they're safe. And if they're not, then they get admitted to hospital and they go to either ICU or step down, whatever they need. And pulmonary comes in and they take them and they make sure that their lungs are working as best as they can.
This, Doug, I wanted to add a little bit too, if I may.
Sure, thanks. And you are a little quiet, Doug. If you can at all, try to speak closer to your mic.
Yeah, I'm almost right up to my screen, but hopefully this is
okay.
Better. But from doing drowning investigations as part of the health department in New York, we did a lot of investigations of submersion events, and what we found is, from those that submerged for as little as 15-20 seconds ended up not surviving, and those underwater have had 2 to 3 minutes and actually survived without a problem. But a number of these were their submersions. They were rescued, sent to the hospital, and then died sometime later. So the only kind of conclusion we're drawing is it's actually very important for the lifeguards for victim recognition and proper surveillance to recognize distressed swimmers while they're on the surface, because once somebody submerges, there's no guarantee of the outcome from what we know right now as far as predicting that. So it goes back to surveillance and set up for success to be able to intercede in an appropriate, as quick as possible before there's a submersion to help assure a successful outcome.
Mm-hmm. Yeah, we had a comment, thank you, Doug. We had a comment also from the audience that maybe PE class could be a good place to educate more about this. We have another question which Joe did address in the chat box, but I'll go ahead and read it off for folks who might be listening. Do the aquatic facilities have to report, or do they report, or is it mandatory reporting to local health departments or to CDC? And I think, Sarah was talking about it's often not the case. So there perhaps are opportunities for getting systems in place with EMS or other stakeholders that maybe are also working on these safety plans. But I'll hand it over to our panelists to see if they have anything to add.
Doug, do you want to address that?
This, Doug, from a required reporting, that really goes back to the local jurisdiction, say health department. It's going to vary with each what the regulations in an area call for. Some of them codes similar to the MAHC require reporting of certain category of incidences to the health departments. And then the health departments in turn have a procedure protocol on how they follow up on that. So it's really going to be dependent on the local jurisdiction and what the requirements are there.
Nice, thanks, Doug. Okay, let's see, do we get another question in the chat? So this is a question about open beaches. How do you recommend we control massive numbers of swimmers on the beach with reference to lifeguard swimmer ratios?
This, Doug, again, as Sarah pointed out, I think the lifeguard to swimmer ratio isn't necessarily the relevant factor. It's about zones of patron surveillance, and whatever the patron density is, can the lifeguards see and observe what they're responsible for? And it's even more challenging in an open water environment when you don't have water clarity. So it's I know from Ellison Associates, say Joe on the line again too. Wish it could be responding to this, but you get this heavy density, and I know like in wave pools or other pools where they guard, you may have inner tubes or density of bathers, so they actually set up, when they're setting up their zones of patron surveillance, where's the lifeguard positioned, and are they able to see, and can they then reach it based on patron density, and they adjust their zones of surveillance accordingly to make sure, or try to assure that the guards have the ability to see and respond in that an appropriate time frame when they're going to be successful. So the way, if you have massive number of bathers, so where are your guards positioned? How many? What's their area they're responsible for? Maybe an open water environment, they may have to be offshore. out in the water on a rescue board or an offshore position, or elevated stands, roving, in addition to positioned on stands, roving guards to try to compensate and to address, the areas that they're responsible for.
There we go. I had to unmute myself. Thank you so much for all those responses from our panelists. Just want to put out one last call to see if anyone has any further questions. If not, you can always reach out to NACHO or to any of our panelists directly. So with that, I would just like to thank you all for attending today, and keep a lookout for the recording. And this concludes our meeting. Thank you all.
Thank you.